request Professor G.P. Talwar to kindly chair this session. Professor G.P. Talwar is the Director Research at the Talwar Research Foundation, a scientific and industrial research organization recognized by the Department of Science and Industrial Research, Government of India. He has received many fellowships and several awards. He was conferred the Padma Bhushan by the President of India. He has more than 600 publications in peer-reviewed journals and is an editor and author of 10 books and monographs. May I request Professor G.P. Talwar to kindly introduce the speakers?
First of all, thank you for asking me to chair this session, which has in fact the real, active head of the foundation as the speaker. I think Professor Gagoli needs no introduction, but let me tell you that he's a walking library. There is nothing that he doesn't know about. Anywhere I've gone, whatever be the subject in life sciences and medicine, he's an expert. And surprisingly, he is right on the point more often than ever before. So he's a very exceptional person of vis-a-vis his capabilities. And of course, he was a gastroenterologist, but I don't think that there is a limit to what he is. He is a true medical scientist in his broadest domain. And what Nirmal has done to bring this organization to where it is visible even from today's meeting. I think it's one of the best meetings. Each year, it's better than before. So, for which I, of course, the credit is, I'm not depriving the credit to Hajela, Dr. and other organizers, but he's the spirit, he's the leader behind who's organizing these meetings. And please give him a clap.
Thank you, Dr. Talwar. I'm joined with Dr. Talwar with umbilical cord because he is the founding father of immunology in India, and when he was the president of the society and when he was the director of NII, he somehow or other involved me in most of his activities, and we are still joined together in the Immunology Foundation, which works to promote immunology in youngsters by providing them fellowships. So in my talk today, because we were talking of the immune systems, and in the immune systems, we need to have some evidence that immune systems, when they develop or the probiotics could coax the immune system to work better. The only way it could be done is that you give something or an antigenic feed to the children and see whether they make better antibodies or they develop better cell-mediated immune response or they develop a cytokine cascade which is beneficial. So if this is the matrix, how do we go about it? Fortunately, every speaker today contributed to my talk. So many of the slides are redundant because they have already made some points, but let me highlight those points. Like this, okay. So the one thing which we learned that the gut immune system is one of the main immune system which a newborn baby builds inside. And we also learned from Dr. Conway that because of the homing of the cells of the mucosal immune system throughout the body, ultimately the rest of the immune system also develops. We have learned from the HIV infection that the HIV viruses first destroy the gut immune system, thereby they destroy the rest of the immune system in the body. So if we are looking at vaccination, both mucosal and parenterally administered vaccine, if the probiotics have anything to do with it, perhaps should work. We also learned that the babies who are disadvantaged or preterm or who have malnutrition carry this signature for a long period. Dr. Conway said up to 3 months. Then Dr. Bruno Pott, when he was talking about, he saw a window of opportunity to intervene. And what he said, that if you really want to intervene, it should be better by 6 months to an year after being born, because if you intervene at that period, you may see some benefits. We also learned, because when I was an immunology student, I learned that the babies are protected by mother's antibodies for a certain period of time, which wanes by the time it reaches 6 months. And the babies in the utero, they are not able to really make so much antibodies, or their immune system is weak and it doesn't develop. But today, again, by Dr. Conway's talk, we learned that, and later on many people substantiated, that babies get bugs from their mother through placenta in the amniotic fluid. This is the latest data, that they get these bugs through various routes while they are in uterus itself. However, we also learned that the situation is not that simple. There could be other factors, environmental factors, which could also modulate the whole system. Then we, as we progressed, we heard that the microbiota in the ladies at the different trimester could be different. And it will be very, very interesting to see that whether the environmental milieu in the ladies could have different microbiota during that time, and which, when the babies are born through non-caesarean method, will be benefiting with the bugs which are already colonizing the ladies, where we saw the difference. So it brings in another set of complexity to the situation. We also learned that there are certain things which, when administered, could cause a problem, and we also learned that the breast milk may have different qualities, and those qualities could also affect in the building of the immune system as well as the responses to immune system. We also learned, and I'm just quoting the speakers who showed elegant experiments, so I need not show those experiments. We also learned that the stress factor, the Quebec ice babies was one very good example, or other stress factors could have a through brain-gut axis, could modulate the whole system. And we also learned that TNF-alpha could be one major modulator which could modulate, which could be very, very effective, one of the effective tools to see how the gut inflammation is controlled, which also have a tremendous effect on what we see. So I was intently listening to the talks, and I'm very grateful to the speakers in helping my talk to progress. So some of the things, so this particular slide you have seen, I will just add a few words into this, that the development of the mucosal barrier, which is an innate immune system, and also the immune system activation, which could be adaptive system, will be important. We also learned that how not to really put bile acids, not giving the significance to bile acid metabolism, that bile acid metabolism also are very, very significant method in which they work. So another thing which this slide which shows that the problem is this, that the science in probiotics is moving very, very fast. And again, one of the speakers said that it depends on the type of the lactobacillus. We got very varied results, and when I show you the vaccination results, you will see that these results varied. Because many of them, as it was stated, many of the studies were done by Lactobacillus GG, and sometimes they worked, sometimes they didn't work. And we have a large number of probiotic benefits. They have been described, but we need to work much more on that and try to find out that why one is working and why one is not working. One of the data which was showed from the THSTI table last year in the posters, if you had seen it, in the Lactobacillus rhamnosus, there were 23 signatures through the NGS sequencing. And these sequences, when looked at the bioinformatic way, like our Dr. Sharmila Monde is here, you will really create signatures where we could weave a matrix that which will work or which will not work. The one of the situation is this, that some of the major variables apart from them are that these are based on immunologic memory. Now we know that some of the basic science in probiotics which have been worked out, that at the gut level, the long-term memory is one of the unachievable thing through the natural infections. However, when probiotics are used, there could be a possibility of building up long-term memory in the gut system. The other area which is determined is by genetics and nutrition. We heard about epigenetic studies. We also heard that how nutrition impacts it. It not only impacts the vaccination results, it also impacts, there has been a large study in the Mekong Delta of children being given anti-malarials who were malnourished, and it was found that the PK/PD data was very, very different, and they were getting less medicine than they should have got. There are other factors which we heard, which are carbohydrates, polysaccharides, and the diet modulation, which are very difficult to measure. So as I said, that we need to go to a surrogate response to infection, and surrogate response is measuring the antibodies after giving probiotics and vaccinate them. So, is there a synergistic effect? In the morning, we heard that apart from building up the immune system and the lymphoid tissues, another very important thing which the probiotics do, they have an adjuvant effect. And very elegantly the mucosal immune responses were brought out, and this adjuvant effect is something very, very important. We also found that the cytokine expressions which move one towards inflammation or move one towards Th1 or Th2, and we also learned that NF-kappa-B modulation to the betterment, these were all showed in the slides today, were also are important. There are some bioactive peptides also when you provide probiotics. We don't know much about them, but one of the major factor in the immune system are the CMPs. So many people say that why not give expose people to sun, that is the best treatment for influenza. Now this slide, I cannot explain the entire slide, it will take a day, but one part I want to know that we were hearing about firmicutes and we are looking about the friendly bugs, and they have a different pattern seeking receptor, because why they should behave differently. And right in the beginning, they get into the immune systems with some of the surface TLRs, which are listed here, and some of the TLRs, which are the endosomal. And most of these probiotics are multi-TLR agonist, except the TLR, and they downplay the TLR4, which is responsible for lipopolysaccharide-like reaction and bad inflammation. And this is the putative mechanism in this. Like probiotic bacteria, we also heard this morning, and I am so thankful to all the speakers, that the dendritic cells, which are also in the mucosal area, they can interact with the probiotic bacteria through pattern-seeking receptor. And we also heard about IL-6, the interplay of IL-6 and the probiotic. And we also learned that the fragments of probiotic, not only the immune cell which enters, the fragments of probiotics also could enter bloodstream and interplay in building up the systemic immune system. So in this particular area, in this particular slide, I show both the bacterial fragments and probiotic bacteria, and we also show that how in the immune system the DCs are activated and how they are activating a chain of cascade, and the IL-10 is moving them towards antibody production and also the secretory IgA production. These are all very important. And the barrier function of the probiotics is also very important. And we also heard since morning the defensins. And defensins are one of the major area where the probiotic and enterocyte interact and strengthen the defensins. Now here, this slide, I will just say that there is a tremendous amount of the interplay of the cytokines. And these cytokines have already been described, so I'm not going further to this. But ultimately, two major modulators, one is the IL-10 and another is IL-12, they play a major role. And we also heard in the morning, which is not in this cartoon, that TL17 and Treg are also modulated by this. So let us look at what are the adjuvant properties of probiotic bacteria to the mucosal administered vaccine. So first thing is the rotavirus, and we see that the IgM, specific IgM response is enhanced. Let me say that these are all very small studies. So Shinjini will not be convinced. Is she here or she ran away? So she may not be convinced that these are, and will say that these are small studies. I admit these are small studies because these vaccine studies are frightfully expensive. Another area where there was a problem, that is the TY21A typhoid, which was an oral vaccine, where we had a problem in immune response, and this increased the immune response. These are all mucosally administered vaccine. The same way, live attenuated nasal influenza also benefited from this. And as you say that most were LGG and KCI-GG, and one of the para-KCI strain was tested in the oral poliovirus. And here again, the serotype 3 elevated polio-specific IgM levels increased. Many of you know that in India, some of the children received 10 doses of the polio vaccine and didn't respond. So these children, nobody ever studied the microbiota of these children, that why they didn't respond. But these guys benefited, and this study I heard in the National Institute of Immunology, Dr. Talwar, when you had invited from Buffalo Dr. Pyarilal Ogra nearly 20 years back, and he had done a polio vaccination study with the probiotics, and he had described that. The oral cholera vaccine, however, had no effect, because oral cholera vaccine works differently than all of those which I talked about, because all of those have little bit of infectivity in this. Oral cholera vaccines are only sticking in the gut, but they have no infectivity item on this. So this is something again very, very interesting, that parentally administered vaccines also worked. And Dr. Conway elegantly said that why they should work, because the entire mucosal system is developed, whether it is respiratory, whether it is gut, wherever they are. So the hepatitis B vaccination benefited by having better IgG. The inactivated trivalent influenza benefited. Then another influenza study showed that all the subclasses of IgG was there. However, there was no different specific IgG or IgA. The DTaP didn't benefit. However, in the hip portion, that the H1N1 B, we found that there was a benefit. And pentacoque, that is the pentavalent part, apart from the DTaP in the pentacoque, the increased polio virus specific IgA levels were seen. In the tetanus, in the pneumococcal vaccine, the tetanus part didn't have any effect, but pneumococcal IgG were enhanced. And same in the hip vaccine, which I already described. So you see that in these small studies, there have been benefits in certain studies, and there were no benefits in other studies. And it was very, very dependent on what kind of probiotic you were using. So if you really look at, and this slide, I have already described that there are pathways which go through mucosal layer through signaling through dendritic cells, and these pathways are IL-10 TGF beta, the IFN gamma, IL-12, and another pathway going straight through IL-4 to TH2. And the another thing which is coming up in the vaccination area, targeted delivery of vaccine through modified lactobacillus as a carrier. Dr. Tyagi in the morning talked about this, and this is also very, very important. Third major thing to benefit will be colonization of the mucosal layer, so you may get a domino effect of all the things working together if you create a strategy to make them work together. So this is how some of the studies were designed. So here the young adult volunteers were given oral polio vaccine. Probiotic or placebo treatment started a week before vaccination and continued for another month or two, where two different probiotics were used, Lactobacillus GG, Rhamnosus GG, or Lactobacillus acidophilus. And serum antibody responses were measured up to 7 weeks later, and it was clear that the probiotics induced significantly higher levels of neutralizing antibodies. Mind you, it was neutralizing antibodies, also higher IgG and IgA. Now this is the rotavirus vaccine, proper immune response. So this was given, Lactobacillus casei GG was given, and then it was followed 5 days of probiotic or placebo treatment, and better response for IgM, IgG and IgA antiviral titers were seen. So this is a study where the rotavirus vaccination and probiotics reduced the infantile diarrhea as an end point. So here, this is a very complex study. I didn't understand this study very well, but I'm just flagging this by saying that the multiple mechanism must be acting over here. And you can see the TNF alpha as well as alpha here and IL-6 playing a very important role through the DC sign IDCs and mucosal IDCs. So in the parenteral vaccines I talked about, prebiotic were given to mothers preterm and their children for 6 months after birth. Children receive routine diphtheria, tetanus and pertussis vaccine, 3, 4 and 5 months interval, and the Haemophilus influenza type B vaccine at 4 months, and serum antibodies were measured. No effect was seen with DTP, as I had said, but there was a benefit to Hib titers. So again, in a complex thing, you could get something which is important. Now this is something which we were talking about, that it is very difficult. Till date we do not have a good HIV vaccine. Many vectors have been used, but and we got indifferent results. Now this one is a recombinant of Lactobacillus lactis in the V2, V4 loop, and HIV enveloped genes have been given. And again we find that there were responses, neutralizing antibody responses, which were boosted in the animals. This is again very, very interesting. We know that trichomoniasis is a parasite, and Trichomonas vaginalis, there is a product known as Solco Trichovac. It is very difficult to deal with. However, and Dr. Talwar had some data on this, that there was a cross-reacting antibodies against abnormal lactobacillus and T. vaginalis, and these antibodies were cross-reacting. And so this is another benefit which is not very well understood, but we talked about reproductive tract organism, and this could be another alternate method. In the pneumococcal disease, we have seen, there is a PROS pathogen 2012, we have seen that both the carriage as well as because one of the major problem in pneumococcal vaccines is that after you give vaccination, there are carriage with the alternate strains, particularly the serotype 19, which has created concern. But the vaccination here with and helping with the probiotic reduce that carriage. The same way, this is something again a parasite. Again, in a malaria vaccination program, there is a strategy. I can't go in detail because I have to stick to time. That it was fine because there is a cycle in all the coccidioids in the gut also, particularly in the mosquito gut. And here, and in the mosquito, also these organisms create peptides which could be beneficial. So here some new data has emerged where we see that they could be built up in the malaria vaccine strategies. Dr. Pawan Malhotra is sitting here. So let me see a proper use, and these are the few last slides, proper use of probiotic and child vaccination. So this was, again, very sorry that there is a small study. Number is only 56. They were given in 8 months, 10 months, 12 months and 15 months period, and probiotic or placebo as they were enrolled, and they were given the normal vaccines which are due to them. Rubella mumps, measles, varicella, and all measured IgG antibodies combined. And if we see that probiotic group was significantly better in inducing these antibodies. But this is something beautiful. One of the major thing what happens in India, that the adverse reaction to the vaccination program. And as soon as a child dies, their activists, they normally agitate and stop the vaccination. So one of the major effort is to put in an SAE system in place to refer the adverse reaction to vaccination to the centers. And here we have a beautiful data that in the probiotic group, the adverse reactions were very, very low. And this is because they can control inflammation. One of the slides I didn't explain that there are three major parts of inflammation. One is through the inflammasome, through the node. Another is through the prostaglandin pathway. And the third is through the IDO thing. And another is the proper handling of NF-kappa B. All of them are done through modulated by probiotics, or their small molecules released by probiotics, or the fragments of peptides released by probiotics. And we need to understand this much more and see that whether probiotics could be introduced in the routine immunization, particularly in the children which are disadvantaged, which have malnutrition, which are preterm, and which may not respond to vaccination appropriately. There was a safety concern which was raised, and I am showing this slide. And one more thing, where we gave the plantarum in Odisha to neonates, and there was a case filed in the High Court, in Odisha High Court, that we have endangered the children by the neonate by giving this. We won the case by showing appropriate evidences which were available. So there are three studies where the life cycle approach was shown, and it is right that in the adults, or particularly the geriatric population or elderly, could these be beneficial in the vaccination? In the study 1, a pneumococcal vaccine was used containing 23 serotypes. There was no difference in antibodies. It was very complex, but lower incidence of infection was seen. And in the same way, the trivalent influenza vaccine again showed a benefit in the response to influenza. Now there have been a lot of safety statuses which have been worked out for these. So it is not that we don't know whether they have any safety concerns, or where they remain opportunistic, or they translocate. I cannot go with individual bacteria, but say that there are differences. So when we are designing, we were told today that we need to design them carefully. And here, these designs will have to be learned. So now my way forward is, we need to create a catalog probiotic repositories through their signatures, through their safety records, and through their ability to look at, we got complex signaling. We have a very good matrix now using systems biology, using bioinformatic information. We could look at that. We should promote clinical studies on probiotic and vaccine co-administration into the program. These will be very, very expensive. This will be difficult to achieve, but these small studies only show a tip of iceberg. We cannot move forward through these small studies. Promotion of research with the probiotics and prebiotics, we heard about importance of prebiotic, particularly the quality of the best milk. This will be also very, very important. And we should have an assessment tool And this assessment tool is very difficult. This is the wrong side. Time will come when for vaccinating your child, you will need to make him drink a smoothie. Smoothies, except perhaps Danone, we may not have good probiotics in them, but it is an interesting possibility. Child will be willing to go for vaccination. Otherwise, when I was a small child and I was vaccinated, I used to run around the house and people used to catch me like a calf and then give me a shot of vaccine. Very difficult. Thank you very much.